Sanibonani.
Hi, my name is Lampoli Kuboneki.
My name is Michelle Kazatchkine.
I'm Dianne Stewart.
My name is John Ataguba.
And I'm here at the G20 Health Working Group on behalf of the Global Fund for AIDS, TB and Malaria. We're very excited to be here because what we're talking about is really the lives of people who can be affected by infectious diseases. We're very excited that the World Health Assembly approved the pandemic agreement recently that is going to help us in future when we have infectious diseases or pandemics that might threaten all of our lives and our communities. We at the Global Fund work closely with communities to make sure that you're ready for anything that might affect your health and well-being, that there is outreach, that there are diagnostics available so that you can find out if you have an infectious disease. And then we make sure that there are treatments and ways in which you can be healthy even if you do happen to contract an infectious disease. We work on AIDS, TB and malaria, but we don't know where the next pandemic will come from. Will it be a bacteria? Will it be something that is infecting mosquitoes like malaria, a parasite? Will it be a new parasite? Will it be a new bacteria like tuberculosis? Or will it be a virus like HIV? So we like to prepare communities for anything. Make sure that there's outreach so you understand how to protect yourselves and prevent becoming infected. And we make sure that we work closely to you to make sure that the services that you receive are quality services, that you're treated with respect, and that your rights are known so that you can be sure that what you receive is a quality product, a quality service, and that all of us are protected. Because at the Global Fund, we believe in leaving no one behind. And we want to focus on equity, making sure that if people in one country have access to medicines, people in all countries have access to medicines. We think that's what the pandemic agreement will help us achieve. So we're excited to be here participating in these conversations, and we're going to work hard to make sure that equitable access and health for all is the future that we can look forward to.
I'm a professor of health economics, and I'm participating at the G20 Health Working Group meeting happening in Johannesburg as a member. The working group is one that is convened to help nations to understand, one, some of the current health challenges, and two, how to find solutions to these challenges. The beauty of the G20 is that it convenes leading countries, and South Africa is happily part of that group. So what it means is there is opportunity to learn from both high-income countries and countries like South Africa, for example. But the bottom line is we are here to help society. Discussions that are being held here, including how to be innovative in terms of technology and how to develop solutions to enable people to have access to affordable healthcare, are things that are critical in many countries, especially in Africa. So the bottom line is society will benefit significantly from many of the discussions that will be held here. We're looking at how we can cross-breed ideas from countries in the global north as well as countries in the global south and bring in all our experiences to bear in finding solutions to help the last person in terms of access to health services. And this is one of the things that is really entrenched in the global declarations that have been put out by the United Nations, as well as the famous Universal Health Coverage Declaration that many countries have signed up to. Thank you.
And I'm a member of the independent panel on pandemic prevention, preparedness and response. This is an international panel that was set up during the COVID pandemic by the WHO and the World Health Assembly to look at what went well and what went wrong during the pandemic. And since then, we have worked hard, and the entire global community has worked hard to achieve a pandemic agreement. And I would like to say to everyone in the communities that this pandemic is not just a discussion between diplomats. It is really bringing foundations for all countries of the world to come together, to share information, to share new vaccines, to share new therapies, to share new diagnostic tests in case we face a new outbreak that could become a pandemic. So please join in helping everyone understand how this unique international agreement is important to all of us across the world.
So I'm from the Wellcome Trust. We're an international medical research funder. We're here at the G20 because we're very interested in questions of how we can work with G20 partners to support big health challenges, things like AMR, TB, pandemic preparedness, the impact that climate change has on people's health. And we're really kind of keen to make sure that in doing that, we talk to governments and understand country perspectives, but also really understand community perspectives as well, because ultimately it's about communities' experiences of health challenges and the solutions to those that are so important to the research we fund and the impact that has. I guess in terms of the role of communities, we're really keen to make sure we have a proper understanding of insights from them, making sure that the research that we do, that we fund, is grounded in communities in places like South Africa, and that there's trust and understanding of the products that produces. We think that's the most important way to have impact, and we talk to a lot of the G20 partners here about how we can work in collaborations to do that.
I'm participating at the G20 Health Working Group discussion. So in terms of the G20, this is very crucial discussion because we are discussing with countries, the 20 most advanced countries in the world, and issues pertaining to health. We all know that our world was hit by COVID, and when we were hit by COVID, we faced many challenges as Africa especially. Accessing vaccine, accessing treatment, accessing even diagnostic. It was harsh and difficult for us. While the vaccinated 200 million people in the US couldn't get one vaccine. So these discussions are trying to get the leadership at the G20, but also around the world to avail diagnosis, to avail treatment, to avail new technology to our continent, especially within Africa here. So at community level, this will help us to access treatment, but also will help us also to access new knowledge, using this knowledge for our own benefit, for our own interest, and also ensuring that us as the community, we are empowered and we know we know exactly we know how to use the new tools and address the health problems that we are facing as a community. So this is, in summary, what the discussion about, and thank you.